Ladies and gentlemen, thank you all for being here and coming to this event. My name is Taryn. A few announcements before we get going. Bathrooms are back here in the back corner. Water fountain. Please take out your cell phone and silence it during the meeting so that we can all hear the presentations. If you need to make or take a call, go and take it outside and then come back in when it's over. This event is brought to you by Indivisible Chewelah. We are a nonpartisan, community-based organization, and we're committed to building community and understanding the issues facing us here. None of our presenters today are associated directly with our organization, but have been invited here to provide us with information on changes we could see in our area. With that, I would like to introduce our moderator tonight, is Lori Thorpe.
Thanks, Taryn. Again, I'm Lori Thorpe, and I'll be facilitating tonight. And how's that? Yeah. Okay. At me. So since January, I have been playing with this concept called finding common ground. And I call myself a finding common ground facilitator. I'm a facilitator by trade, and now I'm finding common ground. It's kind of that simple. I'm up to finding common ground with people who think and disagree with how I think. And it's not easy, but it's really valuable. And there's this little handout, and I have a few of them that I'll leave if anybody's interested. What I want to share with you is that I've been sharing this idea with others since January. Probably have talked to 500 people, a number of groups from here to Spokane to Davenport. And people's first reaction is usually this, finding common ground. I'm up for that. So there's this resonance that I haven't seen in my work in a long, long time. And I've done a lot of group facilitation. So this finding common ground concept is getting traction. I was able to share the idea with Shelley Short, our state senator, earlier, and found a connection there. So what I see is it is crossing partisan lines. Most of us want to find common ground. Most of us believe we're more united than divided. So hence, these type of nonpartisan events become the way to really understand where the community is at on issues. So hence tonight. I'm excited to share this nonpartisan event around an issue that touches all of us. Whether we personally know somebody on Medicaid, we typically are all somewhat informed in Medicaid, and most of us are touched by it with our family. Almost all of us know somebody who's on Medicaid. And it's a wild time in the world. So what a better time to come together as a community and start to talk about an issue that affects all of us. So I want to go over the objective and the agenda, and then we'll get started. So our objective today is to learn about Medicaid and potential changes. You're going to hear from 6 panel members. Our agenda goes something like this. Welcome, which Taryn just did. Then we're going to hear from 2 panelists. Several of them will be on Zoom. We'll have 2 panelists, then a testimonial. 2 panelists, then a testimonial. We'll do it 3 times. So we have 6 panelists, 3 testimonials. We'll take a break with water and cookies for those of you who didn't eat dinner. And then we'll come back with questions. And the way we want to do questions, because of the number of people here, is as the speaker is speaking, if you have a question, there was index cards to pick up front. If you didn't get one, you can raise your hand. If you need an index card, raise your hand. Somebody will bring you one. You write down the speaker's name and the question you have for them. And then at break, a number of us will get together and we'll sort and categorize the questions, and we'll come up with 5 or 6 that seem to be the most of interest to the group. And then we'll dialogue with our panelists around those questions. We'll be done by 8 o'clock, if not sooner, and then we'll do a quick closing. So that's where we're headed. Ground rules. Again, it's nonpartisan. It's really a lot of information sharing. Most of us get our news through some algorithm, and it's so parsed. There's a million different lenses to get your news, and hence that shapes how we view things. So the idea here today is to hear from a cross-section of folks. So the ground rules, listen. Really, soak it up. We're going to hear from a number of experts about our world. So it's an opportunity most of the time we don't get. So listening, questions go to the card. The idea here is to get questions answered. If you're getting triggered, and many of us do in these situations, they can be very emotional. Taking a deep breath, you'd be surprised how magical a deep breath can be. Or even doing this right here, taking a deep breath, it really just centers you and calms you. Walk outside. If you need to leave, just like the call. If you need to go, walk outside, take a deep breath, walk around the block. Great. If that isn't enough, you can scream at the sky. Do that away from the building if you're going to do that. Or hug the person you came with. Okay, but do something to release that getting triggered. The idea is to really be able to be in the learning mode, listen, soak it up. Panel questions is each panelist was asked to answer these questions. Who are you and what organization are you with? What services do you or your organization provide in Stevens County? How many Medicaid patients do you serve, or what percentage of your revenue comes from Medicaid? How will your ability to provide health care be affected by proposed cuts? And then anything else they'd like to share to the group. We have 5 minutes for each panelist, and I'll keep time on that, and then 3 minutes for each testimonial, and that should get us done right about 7 to take our break. Any question? Off to the panel.
All right, so I'm really hoping that we all come away from this evening with a little better understanding of the future of healthcare access for all of us in Stevens County. So with that, let me introduce our first presenter, Jason McGill from the Washington State Healthcare Authority.
Hi, good evening, everybody. So much to be here with you in the Stevens County area, and I'm thinking of my good friend Mary Selleck, our former Secretary of Health, who passed away recently, a longtime resident of Colville. I wish I was there with you, and I wish she was with us through these challenging times. I have a slide set here. I've sent that to you, and I really commend all of you today to taking this effort. I wonder if you would like me to just share my screen, and if that works for the audience, I'm happy to try to do that, and set a stage of what is Medicaid in Washington, and what do some of these congressional policies, what might impact be for the program. And I happen to have the honor and privilege of working for the State of Washington Healthcare Authority and help lead our Medicaid program for the state. In Washington State, we call our Medicaid program Apple Health. It is our moniker, it's sort of our brand name, and of course, you are all very familiar with the importance of apples in our state. What is Medicaid? It is really our health coverage, health insurance product for people who have low income, who are disabled, who are aging. And I'm so thrilled to see Lynn and Lauren here, who help represent Lynn, the aging community, and Lauren, our hospital networks, and so critical. And of course, Medicaid is a backbone system for all of that. Go on here. Now, I'm going to just go through some of these really quick, and you have the resource, and Tara, you can send this out. It's online at the Healthcare Authority, and you can use that however you need. But generally, Medicaid is a state and federal partnership, and that is why some of these congressional policies are so important, because the federal government pays actually most of the Medicaid bill. And then the state matches that, and then we fund Medicaid. It's not like Medicare. Medicare is fully funded through the federal government, and of course through Medicare Advantage plan that individuals buy on their own. Medicare is different that way. Medicaid is a safety net program, again, for people who are poor, people who have disabilities, and people really who are aging and in need for health care. Of course, it's a full set of services, so we're really talking a full and coverage product. Quite frankly, in the behavioral health space and other areas, it is a very comprehensive service. And that's because we serve many people with very complex conditions that need that level of coverage. Here's a general outline of how to qualify or who is qualified for services. FPL means federal poverty level, and about 100% of the federal poverty level, 138% exactly, is about $24,000 a year for an individual. That's how much you make to qualify for Medicaid, so we're talking very low income. And of course there are different coverage categories. Children, we cover all children in Washington, and that requires us to capture a higher federal poverty level for those families. And so we want working families and we want children covered. And as you know, many employers do not provide health insurance coverage. So Medicaid is a safety net to cover all children, and that includes pregnancies and related services. Here's just a little bit more detail about income eligibility, so you have that information. And here gets some information, as you can see in the 5th District, and there's Stevens County up to the north. You can see how Medicaid would be impactful overall. So we're talking about 30% of the people in the 5th Congressional District, Eastern Washington. For adult Medicaid, we're talking about 22%. For children, we're talking about 54%. That sounds like a lot, and that's because we cover all kids in Washington. And that's also because a lot of employer plans have underinsured or do not cover health insurance. So we really have to be thinking about these employer and employment requirements. Most people are employed, especially with child coverage. And Lynn, I'm sure we'll get into a little bit of aging and disability coverage here, but as you can see, a significant portion of really our critical needs. Medicaid is our long-term care system in Washington and the rest of the nation. So we cannot ignore the importance to long-term care and coverage and services for people with intellectual developmental disabilities, and how critical Medicaid is for that.
Jason, can you
Here's a quick. Yes, please.
This is Lori, the facilitator, and I'm sorry, you have about 1 minute to wrap. Oh dear. We have to stay
You
on
bet.
time. Okay.
And I was working with Karen earlier, and I know I'm setting the stage here a little bit, so give me just a little bit more time, Lori, and then I'll hopefully give you all the information you need for the rest of the night here to have a good conversation.
Perfect.
Here is a snapshot of the federal congressional policies and the impacts on Medicaid. We're talking work requirements. We're talking, again, that federal financing share. So again, state federal match. The federal government may pay less and may penalize states for certain policies. And then there are some technical issues. We have some significant, what we call provider and bed assessments for nursing homes, for hospitals. We are hopeful that will work, but there are risks here, depending on how the federal government will apply policies that way. So we really are looking at that carefully. And cost sharing. Medicaid does not have cost sharing. And the vast majority and congressional bill implies that. What we applied to 620,000 adults on Medicaid. And it is a requirement for further coverage. It is an administrative issue for people to have to continue enrollment. And it is estimated that not because of employment, it is because of the administrative burden that people have to go through to check the box and reapply, and all of that requirement that people may not remain covered in Medicaid. And it is estimated as much as 138,000 people may lose coverage. In addition, through the variety of other eligibility policies, many other people may lose coverage. Or if they fail to pay a cost share as part of their premium, they may lose coverage. And this is the concern for people losing coverage. And then, of course, those people who lose coverage, there's less funding in the system for long-term care, for hospital care, for community health care, for rural health care. And that is the concern for losing some of these. I'm just going through, here's snapshot of our hospital care. We're talking $3.36 billion in payment today in the state of Washington for hospital care. We're talking $666 million for community health clinic care. And as you can see, 72% in District 5 alone. School-based health care, school-based health services, rural health care, critically funded by Medicaid. Let me leave it there, and thanks for the extra time. Hopefully that was helpful. And again, we have these slides and information for any purpose you need. Thank you all.
Next, we're going to hear a testimonial from an individual who's had an experience with Medicaid. Please welcome Roger.
Thanks, Darren. My name is Roger Pike. I'm a nearly 50-year resident of the outskirts of this town. My kids went to this school. Like a lot of people in the audience here, I know people that have been on Medicare, or Medicaid, within my own family. I've not been, I've been lucky. But within my own family, I want to share two examples of how Medicaid has been a lifesaver for these families. First off, my wife, nephew, he married, he worked, she worked. They got pregnant, and she came down with a medical situation that required the babies to be delivered very, very early. One of which is today, they're 14 now, one of which is profoundly disabled, wheelchair, round-the-clock nursing care. A lot of that provided by family, not all of it, because just don't have all the skills. The other son, very high-functioning autistic. He takes less day-to-day, minute-to-minute care, but he's a handful. Without Medicaid, I don't know how these people would have gotten 14 years down the road with these kids. The second example in my life I want to share with you is my mother. My mother graduated from nursing school in 1943. And when the U.S. entered World War II, she signed up for the Army Nurses Corps and was posted in various places. By war's end, she was in Paris in a hospital taking care of newly injured soldiers. After the war ended, she met my father in Paris, who was also in the war. They found their way back to the States and hooked up again in the Chicago area, got married, and here I am. They lived the typical post-World War II American dream. My dad had a good job, my mother could stay home and raise kids, they had a car, they had a house. All the things that we're supposed to do. Well then, they decided they'd like to have a little bit more. So when I got out of high school, my mother went back to nursing school for a refresher, and she went on to a 20-year career in cardiac intensive care. When she retired, my dad had died by that time, when she retired, she tried to live out a decent lifestyle, but she lived too long. She ran out of money, she ran out of funds. She was down to a Social Security and a small pension. And when her health deteriorated to the point where she could no longer live on her own, she had severe osteoporosis, rolling over in bed could break bones. She ended up in a nursing home. They bled her dry until there were no more resources, and then Medicaid kicked in, as Medicaid does for old people. Without Medicaid, though, what would have happened in that last couple of years of her life? I'll leave it at that.
So So next, we'll hear from Lynn Kimball from Aging and Long-Term Care of Eastern Washington, and that'll be our last Zoom, so hopefully you guys will be able to hear the rest of it.
All right, well, thank you so much, and thanks for letting me see it today. I'm sorry I couldn't be there in person. I'm only an hour south today, so, but thanks for a little tight schedules today, so thank you so much. Yeah, Aging and Long-Term Care of Eastern Washington, we provide services that help keep people at home through both our community-based services as well as through Medicaid. And we're going to focus on Medicaid and what does Medicaid and long-term care look like. And for us, we work through Stevens County, through Rural Resources Community Action. They provide most of our services and supports in the county. We serve Berry, Stevens, Conroe, Spokane, and Whitman counties. And of the people we serve that are getting Medicaid support in their own homes and getting long-term care in their homes, we have about 5,000 people on our caseload, and 340 of those are in Stevens County. We also have other Medicaid waiver programs that also help. In addition to that, the paid caregiver that's coming into the home to do personal care. We have another program in Stevens County that serves another 118 individuals. So we know it's a good network of people that are mostly older adults, but are also adults with disabilities that need help. They need assistance in order to stay at home, in order to remain a part of the community. What we often don't think about is Medicaid is the primary payer for long-term care in the United States. So in Washington, when, as you just heard in that story, is people exhaust their resources, whether it's from having to go to a nursing facility and having to stay there, or they're looking privately for care, or maybe they just didn't have resources to begin with. Medicaid is that safety net that makes sure that people can get that support, that they can get a caregiver, whether it's a family member, a friend, a home care agency to come in, help with bathing, dressing, all of those essential tasks, transportation, which we know is really critical if you live rural. And without that support, people often go without and end up in hospitals. They do end up in nursing facilities and other places because their health deteriorates and destabilizes. Medicaid for our agency and what we do in our local case in Eastern Washington is 64% of our budget. So it goes a long ways to supporting not just what do we do to keep people in their own homes, but also provides infrastructure so that we do other services and supports. So without that kind of funding to really help and have people on the ground in local communities, it really jeopardizes the system. The entitlement in Medicaid for long-term care is to nursing facility care. If we swept away a lot of the resources that were for in-home care, there just aren't nursing home beds, and especially non-nursing home beds in local rural communities to house people who are getting care today in their own homes. So this is a risk. When we look at the proposed cuts to Medicaid, there isn't, nobody's saying, okay, we're going to directly cut Medicaid long-term care and cut the service. What ends up happening is because so many of the different policies in the bill restrict how many resources go to the state will then have really hard decisions to make about, do they restrict eligibility? Do they make it so you need more care in order to qualify for care in your home? Do you need more assistance with daily living? Do you need a lower income level to qualify? So there's different levers they can shift depending on what resources are coming into the state. So with bills like this, we don't know what the outcome will be. The state will have hard decisions and budget decisions to make, but they could end up impacting those older adults and people with disabilities that are living at home. We're also concerned about the work requirements, as you can imagine. They did create some exemption categories, so if somebody is on Medicare and getting long-term care in their home through Medicaid, they're going to be okay, they'll be accepted. But we've seen a lot of younger people with disabilities who've been in car accidents, could have traumatic brain injuries, with major chronic conditions, had amputations, and they need that assistance. If they need to navigate exemption processes, adding additional paperwork. We have trouble getting people through the process as it exists today. I can't imagine the amount of administrative burden that's will be put on people who are already ill, they're sick, they just need care, and they just need support to stay at home. So with that, just thank you so much for letting me come and talk today, and I'll pass it back to Lori. Thank you.
Great, so next we have Susan Hitch representing Catholic Charities and Lights.
I think I can project. People on Zoom can't hear you.
Okay.
Good evening. My name is Susan Hitch, and I am a home care coordinator for Catholic Charities. My role is to place certified caregivers into homes. We have offices in Chewelah. We have offices in Chewelah and Caldwell, and we serve Stevens, Ferry, and Connery counties. These three counties are known as the Tri-County area. In-home caregivers are typically employed by agencies such as ours or Consumer Direct. This is an employer from the state of Washington. We provide the elderly and disabled in our communities what is known as ADLs, Activities of Daily Living. These tasks are essential to keep them safe in their homes. Some of our duties include, but are not limited to, housekeeping, meal prep, grocery shopping, travel to medical appointments, bathing, personal hygiene, grocery shopping, and med management. We provide a service to the most vulnerable populations. Many are isolated due to their locations and lack of resources. Often our clients do not have support systems such as family or friends that are close enough geographically to help them. Not only do caregivers provide care for clients themselves, but we also provide respite care for members of the family that have taken on the primary role of caregivers. This allows for these folks to be able to work and support their own families and to be able to provide a much needed reset for the daily demands of caregiving. Often we are the only faces some of these clients see each week. Cutting the budget for Medicaid most likely will result in an increased need of placement to adult family homes or skilled nursing facilities, which already have waiting lists for admissions. Often clients are forced to transfer to facilities out of county due to lack of open beds. Many of our clients have chronic health conditions and would surely need these facilities with our services. Nursing homes monthly costs are far higher than in-home care costs. Cuts to this program will strain an already struggling rural hospital, resulting in higher admissions to the ER. Visits to local clinics will increase. This will cause limited availability for appointments, and this will lead to longer wait times for follow-ups to see their primary care. Our in-home care programs are funded 50% by the state and 50% by the federal government. As of November 2024, Stevens County serves over 489 clients with in-home care, a total of 700 clients in the Tri-County area. Making cuts to the long-term care services sets the stage for a ripple effect throughout the communities in Stevens County. If cuts are to be made to Medicaid, it should not take services from the most vulnerable populations, such as our children, elderly, and the disabled. Thank you.
Thank you, Susan. Is Rachel King here?
She's there.
Got it. Perfect. So our next testimonial will be Julie Sparkman, if you'd be so kind. Hi, my name is Julie Sparkman. Okay, can you hear me?
That's better.
Okay. My name is Julie Sparkman. I live in Spokane, and I'm a home caregiver. I'm a member of SEIU 775. I am the person that goes into homes and takes care of them.
And I came up here today. I took time off work and drove an hour because I feel like y'all are my neighbors up north. You're the upstairs neighbors, and your access to Medicaid matters to me. So there is a very real possibility that caregivers like me stand to lose our jobs or lose the funding that would gut the programs our clients get, which means we would have to take on a second job. And I used to be very passionate about saving Medicaid because I can go get another job and my clients cannot go get a different life. But that all changed for me 2 years ago. And now I'm passionate about it for a whole different reason. 2 years ago, my 21-year-old daughter with a 4-month-old baby went to work. She believed, like all of us do, that if you do the right things for the right reasons, and you do it in the right way, things will work out in the end. And that is simply not always true. While she was at work, my grandson was in a car with his father, and they were hit by a drunk driver. We didn't even know what had happened. I was at work, she was at work. Before we even found out, he was in an ambulance. He was taken to Sacred Heart. He was in the PICU. He was being taken care of. We didn't even know that that was happening. And the reason why he was getting that care is because for decades we have built the infrastructure that allowed for that to happen. We have the skilled nurses, we have the doctors, we have the machines, and a lot of that is funded by Medicaid. We have these systems on purpose, and they save people's lives. It was the worst moment of my life when the chaplain called me as I was trying to get there, and I had to pull over on the side of the road because I don't know why I was driving myself. I had an amazing ending to that story. My grandson got to come home a month later. He came home with lifelong challenges. He came home on a feeding tube. But he came home to meet those challenges. And the truth is, it's not theoretical to think that those things are going to happen. You can do all the right things, all the right ways. And an accident, an illness, those can still happen. When those things happen, for you guys, I want you to have the same access to a good ending. I want you to have the same access to a hospital, to quality care. I want you to be able to go to work and know that if something happens to one of your loved ones, someone will be already taking care of it before you even get a phone call. If he had been hours away from the nearest hospital, we would be having a very different conversation today. You guys are rural. You need your care. It needs to stay in place. And so now I'm passionate about saving Medicaid for everyone else. Thank you.
Yeah, I'll share a question, and if one of the speakers wants to address it, then they'll raise their hand on Zoom and you can tell me who. Yeah, okay. Okay, so if there's some duplicates, we'll run into them and I'll sort as we go. How will these changes affect the $5 million grant to the new Northeast Washington Health? Did I get that right? Yes. Okay, can anybody address that? How will this affect the Northeast Washington Health grant, $5 million grant? No hands on Zoom?
There's somebody.
Where?
Were you raised?
No question. Anybody have insight into the Northeast Washington Health Grant, $5 million? Well, we are, and that's why I'm talking into this.
So Northeast Washington Health, I don't know which specific grant, but my guess is if it's a Medicaid grant, it can impact services. I don't know. It depends on what grant. We're not the ones in it.
So if there's something more specific, the person who asked the question, just let one of us know later. We can follow up if there's something specific. Okay. All right, well, if we can't get an answer, we'll follow up. Okay.
This is it right here.
Okay.
Big thing on the front page, all about the new thing that's coming in.
Okay. So I'm going to let somebody read this. I don't want to stand up here and read it. Why I continue, and then we'll circle back. Okay? I think somebody sort that out. I've heard that our own local hospital could be chosen. Is that really a possibility? Or could close? Is that really a possibility?
Yeah.
I'm seeing a number of nods here. Anybody on Zoom want to address it?
I'm still having trouble hearing, but I think Lori raised that question. I think that was sort of prominent since we have the hospitals in Stevens County.
Yes.
So I will say I'm not aware of any plans to close either hospital or facility in Stevens County. These are really important hospitals. That being said, there's a lot happening, and I do think that we will need to think creatively about how services are provided and what's available and how we deliver that. But the proposals are not final. That's why we're doing everything we can to advocate against cuts to the Medicaid program. And moving forward, aside from making sure the hospitals stay open, in terms of any services that would be impacted, it's an absolute priority of our leaders to make those decisions with the long-term sustainability of our mission in mind. And our mission is to serve all, especially those who are poor and vulnerable, which would include those on Medicaid. So I know that that's a big part of what would be part of the discernment of moving forward and how we would enact any cuts.
Okay. Anybody else? Another question. Will my non-working wife lose her Medicaid? That's a specific question. Will my non-working wife lose her Medicaid?
It's ringing. I haven't muted. Sorry.
Oh.
Sorry.
Oh, say it again. Okay. Will my non-working wife lose her Medicaid? Yeah, it probably would depend on her particular situation and what the work requirements are and that kind of thing. Anybody from the Zoom want to take it on? But I think what I heard is that with the potential changes, that there's the potential to impact just about anybody on Medicaid, depending on their specific situation. So it's one of those things to stay tuned into.
Yeah, one of the things and really in that section of it, there's a couple different ways that the work requirements hit. And it's something like 80 hours a month that people have to work or do community service or be in an educational program. And then it kind of has a section that it says the secretary will develop other exemption categories for special circumstances and things like that. What we don't know is what will those special circumstances look like and how will they define it. And so that's where a lot of the unknowns come in of what is that going to look like, what would the process be, how often do you need to submit paperwork to try to show this is what's going to happen, and to show you meet those qualifications.
Cool. And our speaker's working better, so we're very happy. Thank you.
The reverb was turned up. Honestly, the thing itself.
Oh, easy, easy.
Feedback loops and yeah. Sorry.
Okay, so let's try this question on. Are there any plans to seek other potential sources of healthcare funding to mitigate potential loss of necessary funds provided up to this point via Medicaid? Other funding sources for Medicaid? Anybody know of anything? We hope the state fills in the gap. Or what else? Okay. Okay. Hold on. Will we still have our own hospital and air flight helicopter? We heard of no plans to close hospitals. Any thinking on the air flight helicopter? If that's a risk.
They're going to expand the airport, I think, in Colville, so I think...
I'm not sure. I think that right now we are all hands on deck on advocacy, and decisions haven't been made because the proposals aren't finalized. So I'm not sure and not able to speak to specific services and those impacts because those are not decided at this point.
Okay. What are the proposed changes to Medicaid and Medicare in the big, beautiful bill?
Cut. Cut.
There were lots of proposed changes. I think Jason, Lori, and I could all hop in here. I'm happy to try to bridge the slide. I think some of the ones that we are very worried about were mentioned by Jason in terms of limits to provider payments or directed payment programs. Washington has a very significant program like this that allows us to draw down federal dollars that support hospital Medicaid funding, and thankfully it was just pre-approved by CMS yesterday, and we're very grateful to our partnership with the Healthcare Authority in making that happen. But moving forward under the bill, those would be frozen. So there's a lot to be worked out in the details, but that's why it's still a concern. It feels like the anvil over our head just got moved to the left a foot, and we will continue to work on it. The other concerning provision is the reduction in payments to states that provide care under their program, which here is Apple Health, to undocumented folks. Since we do that, we think that can reduce payments. And then there are some other concerning provisions that I think they were all outlined in Jason's slide. So I'll refer to Jason. I hope he's able to unmute, but we can see.
I did.
Jason. Oh, there you go.
Yeah, and I think you covered it well, Lauren. I think I might just add the work requirements, cost sharing, and many other eligibility requirements and restrictions that therefore probably will significantly reduce overall eligibility to the program. Somebody mentioned their working wife, and Lynn, I think you covered the work requirements well. We may have some flexibilities on how we implement that, so it may be very case dependent. We may have some flexibilities on how we implement cost sharing, but as written, these are fairly strict and potentially significant reductions in how somebody would be eligible and would enroll in Medicaid. You mentioned the other question, and Lauren, you just mentioned the major penalty to states who are offering programs for people who are not qualified for Medicaid, immigrant health programs particularly. And in Washington, we have three. We have one for children, one for pregnant, and one for very poor adults. And those programs may require the state to pay as much as a 10% federal match penalty, which is about $460 million that the state just simply cannot make up on the state budget alone.
All right, another question. This is a trivia question. What is the average age of people in Stevens County? Anybody? Really is a question. Anybody? I think the question is, how old are we? How Medicaid oriented are we?
58.
60 something? Yeah, so older. Here's a question. I think this, I'm not sure I understand exactly what it's referring to. Whole Washington organizing. What is Whole Washington? Is that like universal health care? Yeah, okay, healthcare for all, universal health care, Whole Washington for the state. Is there any organizing? Have you heard of this? Yes. Some nods? Anybody want to address it? What's up with Whole Washington? Okay, sounds like there was a meeting 9 months or a year ago. Anybody want to address Whole Washington?
Is it existing or? heard about it, that's what it was, but.
Can anybody? Lisa? Here. Whole Washington is an effort in Washington State to bring universal health care to Washington. They have been working, there were bills in the legislature, both the Senate and House this past session, for the Washington Health Trust, which would create a healthcare system much to be on the that you could buy on in the exchange. Thank you. Lost the word there for a minute. It did not go anywhere, but the group is still working towards universal health care in Washington, which I am very interested in, and I'm going to get more in touch with. We've been too busy, but get more in touch. There was an initiative effort a couple years ago that did not go anywhere. They will eventually probably have to do it again. I don't know, but that's where it seems like we're heading. But if how would something like this affect whole Washington, or how would it come in place or tie in? I do know that there was a resolution that was passed in the state this past session that was going to request, they would have to request a waiver from the federal government to use Medicaid towards the whole Washington, to the universal health care, and that did pass, the resolution to request this waiver. So that piece is done. But Medicaid dollars, if there were any, what there were, would be applied towards the Washington Health Trust. But of course, nothing's gone through yet. But it's still out there, it's still being worked towards. Okay, another question? This is for Susan Hitch. How will existing clients fare with home care, How will existing clients fare with in-home care?
So if they lose their Medicaid services, so there's a line of, so it's all about money, right? That's what it's all about. It's about their income, what they have to pay for and what they don't have to pay for. Some of our clients have what we call participation. So some of them already pay for their monthly services. I would think that if those people that are not having to pay right now for services, if they raise that level of income or lower it, however you want to look at it, the people that are not paying now would probably have to come up with a participation, and a lot of them will probably choose not to, based on their income and what they can afford to do. So this is a big deal for people that have caregivers.
Thank you, Susan. Also, trivia, the average age in Stevens County is 46.8 years, so we're getting younger.
We're all over the hill. We're all over the hill.
How will QMB or OMB, how will QMB and SLMB be affected? I don't know those acronyms. Anybody? SLMB.
Those are programs to help people. And Lynn, you might know this better, so let me stop. Do you want to take this one?
You might have a better handle on it. I know the experts know it in my office, but.
Well, let's try. These are programs that help people spend down to qualify for basically a Medicare supplement plan that the state pays. And if you have a certain income level, you're not qualified. So these programs help you with that qualification, help you spend to a level where you are qualified, and sometimes it takes some time to get to that point. And yes, the congressional bill does restrict those programs, at least as proposed from the House. Doesn't eliminate, but it does restrict and reduce the eligibility. Again, there's a theme here of restricting, constricting, requiring many steps for eligibility and enrollment that reduces the enrollment overall.
Thank you, Jason. Anybody else? This question may have been answered earlier, but I'm not sure. Are there any changes that would impact maternal care, such as labor and delivery in Stevens County?
I think I would echo again. Fortunately, we have in Washington very good eligibility for labor and delivery for pregnancy care. And I would hope that would remain. But if the federal share changes and restricts the state share dramatically, where is the state going to find the money? Will it have to restrict coverage related to these programs that the state has choices? The state can restrict from a more generous pregnancy coverage to a less generous pregnancy coverage. It can restrict that eligibility and then be able to afford that amount of coverage. And we're not talking dramatic eligibility here, folks. This is, let me pull up the slide here. I won't be able to share it, but I'll give you the detail. Births in Washington today, Medicaid pays for 35,400. That's as of last year, 2024. That's about 45% of all babies born in the state. So we're talking pretty significant and really an important coverage that's at a core of what Medicaid provides. So I would hope not, but I am concerned that overall restrictions and federal funding restrictions could result in those reductions.
Thank you, Jason. A couple more questions. If we are to lose $2.5 billion in Eastern Washington Medicaid, can you describe what that would look like here?
Well, if I may just, first of all, I think we have to look at the current legislation is less, it doesn't cut as much as the initial proposals. It's hard to put a fine point on it, so it might be in the range of 500. It could be even more. It may be up to $1 billion. So very hard to put a range on that. But fortunately, I do not think it's that high of a range at the $2 billion level. So let me just start level setting. Still significant. State's not going to be able to come up with the money, but not that significant as of some of the initial proposals. Again, hopefully that helps at least clarify, and let me defer to our other panelists here if there's any clarification, or you may be looking at some of the hospital funding in that regard.
Jason, I think you said it well. You know, things have been happening fast, so we are still working on what the estimates look like for what passed the House. It's not as easy as one might think to work through what these changes can mean, especially a lot of the estimate is going to be based on the fact that there are just a lot of people that are going to lose coverage because of the enrollment process and red tape that they would put on the program. So what that looks like in terms of exact impacts is really hard to estimate, but we are concerned that it will be a significant loss for hospitals, and we know that the state has limited options to backfill the funding just based on the size of the gap that would be caused. So it's, unfortunately, I know that's a non-answer, but I just wanted to be transparent about what we know and what we don't know at this time. And I know that it's not easy to hear that the future is uncertain, but that's why we're really trying to help shape the proposal as much as possible and reduce the impact to people.
Yeah, those are big numbers. One last question here to that question I addressed earlier. How will these changes affect the $5 million grant given to New Health? And here's what the newspaper summary is. The little over $5 million in funding for development of a regional workforce development center. The Washington State capital budget has allocated $5 million in bond dollars to support reinvestment efforts within our communities. So it's state money. Yeah, so is there more to talk about this? I'm not really tracking it. Anybody? Enough?
I'm not either. I wish I had more information on that one to help you with. If you'd like me to follow up, I'm happy to look at our state colleagues and see if we can learn more for you.
I think it
Please.
has to do with the redevelopment of Lincoln's Middle School into.
I have a sense too, it may not impact, the federal congressional changes may be unrelated to that funding.
Yes, that's what
state. It's like state commerce funding or workforce funding.
Okay, so here's the next question. How can we most effectively advocate to keep our funding?
Well, I'd be happy to hop in. I think really sharing your individual stories. You've got organizations like Providence and entities like the Healthcare Authority in the state that are able to share big numbers of the impact and of what that means to the care that we provide. But you all are the experts on how this impacts your life, and oftentimes those are the stories that stick with lawmakers more. So I would encourage, our portals, the many faces of Medicaid, you can Google that and it will come up. And there are ways that you can send messages into lawmakers, but I know that there are many other advocacy groups. Protect Our Care is one of them that we are a part of with SEIU. They encourage you to reach out to your members of Congress, whatever way that is easiest for you, whether it's through one of those platforms, an email, or picking up the phone and leaving a message with their office. It really does make a difference.
Thank you. So I think we're right here at the end with all the questions. The whole point about getting active now, telling our story. So there's an Indivisible Colville meeting on June 1st. There's an Indivisible Chewelah meeting June 2nd. There's an Indivisible Northeast Washington and Deer Park June 2nd. I know there's rural Indivisible in Spokane. These things are happening. So these are upcoming meetings to get engaged with. I can see at those Indivisible meetings talking about how do we advocate for this funding? How do we tell our stories? They get very focused on that. Did you have something? Okay. Any last questions before I turn it to Taryn for closing comments?